From the Leeds, Grenville and Lanark District Health Unit, I'm talking with the Manager of Clinical Services, Jennifer Adams. And the reason that Jennifer is here is to tell us about the infectious measles and the surge that is happening out there. And you really, really, really need to listen to this, please. Welcome to the program.
Thank you. Thank you for having me.
And you're going to give us all kinds of information today so that we can hopefully protect ourselves and our families and our loved ones.
Yes, make an informed decision about your family's health.
Okay, so let's talk about measles. It's very infectious.
It is very infectious. Yes, it's one of the most infectious viruses that we know of right now. And it's one of the really important things is that 90% of people that come into contact with the virus who are not vaccinated will become infected.
So as we were talking off camera, growing up, I had German measles, and I had a vaccine, an injection for that.
Yeah.
But that's wiped right off. Like it doesn't.
We don't see very much of that, and that German measles are also called rubella, and they're different.
Yes.
Different viruses. Yeah.
So this is very infectious stuff.
Yes.
Okay. So what are the symptoms?
Yes, so symptoms are typically like any other respiratory virus that we see when it first starts. So those flu-like symptoms, fever, aches, pains, general malaise, those kinds of things. You may even think your kid or your child or yourself has just the common cold.
Okay.
But what typically happens is within a few days, a red blotchy rash will start to appear. Typically it starts on the head, face area, and then migrates down the body. And the other telltale sign of measles is spots in the mouth.
Spots in the mouth. Now, when you're saying spots in the mouth, are we talking like a white spot, a red spot? Because our tongue is red.
Yeah, sandpapery, blotchy kind of rash, and it tends to go everywhere.
Oh,
a little bit different than chicken pox where they're more pronounced.
Yes.
Bumps and pustules, and this looks more blotchy, more red, rashy kind of sandpaper looking.
People will know when they have it.
Yeah,
they will.
It's pretty distinctive.
Yeah, I think so. So how is this spread?
Yeah, so it's again like any other respiratory virus. It's spread through droplets.
Okay.
But the most important thing to remember about this is that unlike something like COVID, where you sneeze, cough, it typically drops relatively quickly to the ground. This virus, and why it makes it so infectious, is it has the ability, it's light and it doesn't weigh very much. So it can suspend in the air for quite a long time, up to 2 hours.
Up to 2 hours. Oh. Yeah. Oh dear. Okay, so if someone in the family has it,
or you suspect that they might have it,
then the whole family could actually end up with it.
Yes, especially if you're not vaccinated. So especially if you haven't completed your full vaccine, which is 2 doses.
Okay, 2 doses.
And they are spread apart, and that's the important piece. So the routine vaccine schedule for measles has at a year, and then not again till 4 to 6. So children under the age of 6 who are unvaccinated or who only have the 1 dose are at higher risk of being infected with this virus. And children under the age of 12 months typically wouldn't have any protection for it.
No, they wouldn't. Their immune system's not built up
and they're not
yet.
eligible technically for the vaccine either, which makes them more susceptible
to it.
Yeah.
Do we have any current cases in Canada now?
Yeah, so currently, and it's changing day by day.
Yes.
But currently there are 6 cases in Canada. There's none locally.
Good.
But we are, as you can imagine, getting more and more calls every day about potential suspect measles cases. And so we're trying to ensure that we are prepared to respond to that as a health unit as well if need be. So.
Okay, so if someone unfortunately does end up with measles, what do they do?
So really important, and especially if you're traveling over March break, really important that if you think you've become in contact with a case or you get sick, wear a well-fitting mask and try and limit your contact with people as much as you possibly can. If you are experiencing symptoms, you should inform the flight attendant if you're on a flight, or cruise staff if you're taking a cruise. Really important because they will be able to, they have emergency plans and so forth that they would enact as well if it was a suspect that there might be measles on board or something like that.
Yes.
If you don't, if you get symptoms when you return home, you need to reach out to your healthcare provider immediately and isolate yourself as well at home.
Do not go to the hospital.
If you have a healthcare provider, that is the best starting point.
You should go to the hospital with measles?
You need to be diagnosed.
Okay.
So if you have a healthcare provider, that's where you should call first because it's an easier environment to control when they would bring you in to do testing. So they could potentially bring you in, prior to clinic opening or at the end of the day or something like that, just to make sure that we're not exposing other people. If you don't have a healthcare provider, there are a couple of options where there's the East Region Virtual Care Clinic that you can go to. That's one option. You can call 811 and get advice there, but ultimately you do need to be swabbed for this. So if you don't have a healthcare provider and your only other option is a walk-in clinic or Emerge, the best thing to do would be to contact Emerge or that walk-in clinic prior to attending, so they can prepare for you to come in. Again, limiting your exposure to other people, so we're not spreading it in our community.
That would be my fear, that somebody would walk into Emerge with measles, and unfortunately, they're contaminated in that area.
Yeah.
Oh wow. So this is not just for children. I mean, this is anybody. Seniors.
Our
families.
focus right now, because of March break and travel that is happening, is families and those that don't have children that are vaccinated or completed their vaccine series yet. We do know that other people may not have full immunity as well, and those people, if you don't fall in that family with children right in the next couple of weeks, contact your healthcare provider to follow up on whether or not you should receive vaccine. We're focusing right now, because that is our biggest imminent risk right now, is travel on the March break.
So are there clinics right now set up?
Yeah, so what we've done at the health unit is we've set up 4 clinics, over 2 this week, 2 next week, for families with children who are traveling within the next 3 to 4 weeks. So in order to access those clinics, you need to call the health unit so that one of our nurses can assess your vaccine, so we're not bringing people in that don't need to be coming in because you're all vaccinated and everything's good. So we can do that assessment over the phone. If people call 1-800-660-5853 and the extension is 2313, you will be required to leave a voicemail. We leave detailed information. We will get back to you. If you do require vaccine, we will get you into one of those clinics and get everybody done who needs to be done in your family before you go on vacation.
So I'm just thinking, the children and the parents are vaccinated. They go on their vacation. Can they still be exposed to measles and actually come home with measles?
You can definitely be exposed to it depending on where you're going in the world. Most countries, and the travel notice that PHAC that just put out is covering all countries in the world, which I think is a significant statement in itself, that measles is back and it is spreading. The vaccine with 2 doses is upwards of 100% effective. Nothing is foolproof.
No,
we know that.
That's
we know that. So again, it's trying to take as many precautions as you can, and what feels right and safe for your family to do. So whether that's limiting the number of places that you're going, being just vigilant about people that are symptomatic and people that are coughing in public and those kinds of things. And again, just doing the best that you can and what makes sense for your family.
And you had mentioned early on about masking. Returning to masking would be a good thing to do, wouldn't it?
Oh, that's always such a hot topic.
It is.
It's a hard one, right? And I think families and individuals, the most important is having the information to make that informed decision for yourself and do what you feel is right for your family and what's going to make you feel safe, as safe as possible in the situations that in the traveling that you're doing. I think you will probably see, I know we traveled ourselves recently, and definitely more people than I thought would be wearing masks.
Are starting to wear a mask again.
Yeah.
Yes, yes. And I think for their own comfort and feel
Yeah.
better. You know, I want to go on vacation, but
You don't want to end up sick.
no. So maybe I'll wear a mask and be a little safer.
Yeah.
Or at least in my mind, I'm a little safer. So we've covered what the symptoms are. We've covered what people should do, especially when they're traveling. If they're in a hotel somewhere and they come down with measles, should they go to the front desk and say, or call, don't go there, call the front desk and say, I'm sorry, but you know, this could be happening.
Yeah.
And just try and stay in the room?
And stay in the room and get advice on where you can go to get assessed by somebody locally. Yeah. So whether that, again, is a walk-in clinic, Emerge, a lot of the cruise ships and stuff have their own medical facilities and those kinds of, but again, you want to make sure that you're identifying that you have symptoms. And even it would be important in that case to probably identify whether or not you're fully immunized or not. So again, it allows medical professionals to make informed decisions about wearing proper PPE and what kind of room are we going to put you in order to do this. And we can be very creative in our ways of, you know, seeing people and getting swabs done and those kinds of things where we're not, again, limiting that spread and contact between people where we can.
Yeah. Oh, wow. We go from one thing right to another, don't we?
Yep.
Pandemic to the measles. Is there anything else, Jennifer, that you want our viewers to know about the measles and to be cautious?
Yeah, I think it's not about creating fear and hysteria.
No.
It's about
Measles.
making sure people are informed so they can make the right decision. And I think I'd like our viewers to know that what we're facing right now is really the perfect storm of global surge. Vaccine rates and coverage rates are way down because of COVID, and resources were shifted in order to manage that pandemic.
Makes sense.
Everyone's still playing catch up. And so I think what we're really looking at is that perfect storm for something like this, where a measles case will be imported into our local community with the potential to then spread in our local area.
And when and if it does, that's when you will be back to talk to
That's
me,
right.
and we will know where the clinics are and who's to do what.
Yes, because response is, again, similar to COVID, contact case management, contact tracing, mass immunization typically is the response to a measles outbreak. Yep.
Thank you for coming in today and sitting down with
Not a
me
problem.
and telling our viewers, because this is important. People
is.
should be aware of this. You know, that it can become worse. We don't know.
Yep,
We're
we
not
don't
saying
know.
that it's going to. It could.
Yeah.
So be aware and be cautious while you're out there. So
And
thank
enjoy
you.
your March break.
And enjoy your March break. Yes, definitely.